Good afternoon, my name is Chrissy Matheson and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead.
Thank you, Chrissy, and good afternoon, everyone. Sadly, on Sunday, we reported another death in our province due to COVID-19. I want to express my condolences to the family and loved ones of the man who passed away. And as of today, we have 5 active cases of COVID-19 in Nova Scotia. Dr. Strang will have more to say and more details, but it is a very clear reminder that COVID-19 is still here. We can go weeks with no cases, but COVID will be with us until we have a vaccine. And we need to do all we can to learn to live with COVID-19. That's why we've enhanced our online Nova Scotia Safe Check-in process for everyone coming in outside the Atlantic bubble. That includes university and community college students. This has helped us track them while they are in isolation. We have also implemented a robust testing strategy where university students coming from outside of the bubble will go through a series of tests during their isolation. We have 26 primary assessment sites across the province, and we added an additional 8 testing sites on university campuses. And they are all actively conducting tests. I also want to thank the federal government for the contribution of $2 billion to help support provinces in the reopening of schools. Our share will be $48 million, and we'll be using this to help keep our students and staff safe. The ventilation systems in every school is being checked and serviced, and that is expected to be completed before school starts. Filters are being replaced and adjustments being made. By law, the air quality in our school has to meet strict standards. One of the things that we've learned with COVID is that the air must be well circulated. So there's a plan to speed up the fans to keep the air moving in our schools. If we need to use some of the federal money for ventilation, we will. And another big issue is cleaning and disinfection in our buses and in our schools. We will use some of that money to support bus drivers and cleaning staff, and if we have to hire more cleaning staff, we will do so. We've also learned that not all of our students have access to electronic devices, and we will use some of this money to make sure that all of our students get that access. Now over to you, Dr. Strang, and it's good to see you, and I hope you get some rest.
I did have a bit of a restful time. Thank you, Premier. Good afternoon, everybody. It's good to be back. Like the Premier, I do want to echo my condolences to the family of the gentleman who unfortunately passed away on Sunday from COVID-19. And I'll give an update. I want to start by giving an update on where we're at with our cases here in Nova Scotia. As of today, we have 5 active cases of COVID-19. The one new case that was identified today is in Northern Zone and is a close contact of a previously identified and announced case. So today we now have 1,081 cases of COVID-19 in Nova Scotia. We've had 72,532 Nova Scotians tested with negative results, and we've had, unfortunately, 65 deaths. Over the past 2 weeks, we've had 3 small clusters of cases in Nova Scotia, all of them originating in the Northern Zone. One cluster involves 2 foreign workers who had traveled to Nova Scotia from another country for work purposes. These individuals had been self-isolating as required and were tested as part of their employer's quarantine protocol. So there were no exposures to anybody in Nova Scotia from those 2 cases. The quarantine process worked as it's meant to work. Another cluster involved someone who traveled from outside the Atlantic bubble to visit family and did not self-isolate. In this situation, the individual incorrectly believed that they were exempt from self-isolation, but they were not. 3 other people, a close contact, and 2 individuals who were at a restaurant at the same time as the case have contracted COVID-19. The third cluster involves someone who came to Nova Scotia as part of their work and later tested positive in their home province. We believe that an individual in Nova Scotia contracted COVID-19 from this individual, and then 3 other close contacts of the Nova Scotian then tested positives. There are no links between any of these 3 clusters. And while follow-up work does continue, and we were still testing people within the incubation period of their possible exposure, other than the 2 cases linked to the restaurant, we have not seen any evidence of community spread. And I want to reiterate that when we announce new cases, that we announce them, but the investigation may well not be complete, and is likely ongoing. So we won't have necessarily all the full details when we first announce a case. It can take several days before we're able to say for certain where a case originated or if there are connections between cases. And to protect the privacy of those involved, including the family of the individual who has passed away, we will not be providing any additional details on these clusters. But we thought it important that people understand the situation of how these groups of the most recent cases kind of fit together. As always, public health, we will issue advisories when there is a risk of public exposure to COVID-19 and we cannot reach the close contacts directly. So as you may recall, during one of these clusters, we issued an advisory around a possible exposure at a restaurant. We do that in cases when we cannot. Our first objective is to reach people who have identified as close contacts and talk to them directly. If we cannot, then we will issue public advisories. So these new cases really, to me, and these clusters illustrate why we have to continue to be vigilant. They clearly show the importance of self-isolation and following public health directives and advice. And we have to understand, as the Premier said already today, there's a clear message for Nova Scotians. We are in this pandemic for the long haul. We have been fortunate to have a low number of cases. We've even had periods of time when we've had no active cases, but the risk remains to Nova Scotia. There's no doubt in my mind that we will see new cases occurring periodically. Our goal is not to have 0 cases, but our goal is to keep our case numbers low and minimize community transmission. And we can do this by everyone following the personal protective measures, by having a robust testing strategy and rapid contact tracing. And that's our objective, and that's what we have continued. We have built our response to COVID from the outset on those core priorities. So we can't let our guard down. We have to continue to all practice the personal preventive measures. And if any Nova Scotians have symptoms that could be COVID-19, it's very important that they contact 811. If at all possible, go on do the online self-assessment tool and get direction. But if anybody feels that they have symptoms that could be COVID-19, it's important that they contact 811 and get direction from there. We continue to have several hundred Nova Scotians being tested every day, which is important. And fortunately, we continue to have a very low positivity rate, and that's our goal. Test lots of people, have a low threshold for testing, and continuing to have lots of people testing negative. We need to continue to focus on testing as a key part of our overall response strategy. I also want to emphasize that people, if you're supposed to be self-isolating, you need to do so. The stakes are simply too high to disregard the rules. And if you're unclear about the rules, ask and err on the side of caution by isolating while you're waiting to get the answer. I've said it before, but I think it's worth repeating again today, that with the return of our students to schools and university, that it will be successful if we can keep our overall case count low and prevent wide community spread. We've been able to do that for the last number of months here in Nova Scotia. But we've seen in other areas, other parts even of the country, things can change quickly if people become complacent. I hear that all the time from my colleagues now. Look at BC and Ontario, where they're pleading with the public to not become complacent because the complacency has led to a resurgence of COVID-19. So there are things that government can do, like testing university students from outside the Atlantic bubble, but there are also things that will keep cases low if we all do them together. So again, this is my appeal to all Nova Scotians to continue to take this seriously, continue to work together to keep our community safe by practicing all those preventive measures, and that's how we will allow our schools and our universities to open and remain open and keep and have safe the necessary safe learning environments in Nova Scotia. So speaking of the university students, last week we announced a testing strategy for post-secondary students so that any students coming into go to university this fall from outside the Atlantic bubble have a number of measures which they are following. All those students must self-isolate for 14 days, and this includes both those in off-campus and on-campus housing. And the universities, the Nova Scotia Community College, and their surrounding communities are supporting these students in this self-isolation period in a number of ways. In addition, during this 14-day isolation period, students will be tested at different times. The majority of them are going to have 3 tests. Some of them have already been here and are close to the end of when we started the program. They don't necessarily need the full 3 tests before they end their 14-day isolation period. But the objective is to have all students tested. The majority will have 3 tests during their 14-day period when they're here. And even if they have a negative result, the full 14-day isolation must be completed. The objective of this testing is to identify anybody who may be asymptomatic, and if they're positive, put them in full isolation, as we do with any case, and really remove them from any potential of social interaction for students while they might be infectious. The students are also having to complete a daily digital check-in, and if they don't complete that, whether by text or email, the university will then be following up those students with more direct reach out. And if necessary, we can also involve local law enforcement as a supplement to the university actions. None of these individual measures, the quarantine, the testing, the digital checkup, none of them are 100% effective on their own, but together, as a combined package, these provide, I feel, a strong level of safety to detect and manage cases very early on, and will allow us to open up our universities the start of in September with a very low risk of COVID-19 as we move into the fall in our universities. And this is especially important in the university sector because of the many shared living arrangements and the significant amount of social interaction that happens on university campuses. I do want to thank the universities, the Nova Scotia Community College, and the Nova Scotia Health Authority for all the hard work they've done in the last few weeks on this. It was certainly not an easy undertaking to stand up all these initiatives, but everybody's worked very collaboratively to get this process operational, and the student leaders have all, from the student organizations, have been a big part of this as well, and have playing a very collaborative and cooperative role. So thank you to the student leaders as well. And I also want to thank the individual students and their families in advance for following the public health measures and doing what's been asked of them by the province and by their universities. By doing so, they are allowing themselves to continue their education in a safe environment. And I want to remind the students about the importance that they continue to do their daily digital check-in as they're here and they share their contact information. We're happy to have students here. They're an important part of of Nova Scotia, an important part of our Nova Scotia economy and our Nova Scotia communities. But we all need to work together to make sure everybody stays safe and healthy. And I want to move on to our public schools. I know there's been a lot of discussion and a lot of questions and some criticism about the lack of a plan to respond to have appropriate safety measures in our schools, as well as a plan to respond to potential cases of COVID-19 within our schools. I know that people are anxious about a return to school. I recognize and understand this. It's actually very normal given that we're in the middle of a global pandemic. But I want to be clear that we do have appropriate public health measures being implemented in schools across the province for our current epidemiology, which is a very low level of COVID-19. We also have options to strengthen those public health measures as necessary if COVID-19 activity increases, whether it's in a single school, whether it's in a community, or whether it's broader even across the province. So we have an appropriate plan for where we're at, and we have an appropriate steps in place to strengthen the public health measures if we need to, if COVID activity increases. I also want to assure everyone that while COVID may be new, we have well-established public health protocols to respond to communicable diseases like measles, chickenpox, whooping cough in our schools and in our communities. We do this all the time, every year. If a case of COVID-19 is identified, public health will act quickly to identify and test anyone who may have been considered in close contact with the individual who's tested positive. That's one of the reasons why we're keeping students in grades 8 and below, and even in the high schools as much as possible in limited cohorts. And so when we have a potential exposure, we have a limited number of people that might have been considered in close contact. It's also important the impact of masking, proper hygiene, and cleaning also are important in limiting any potential spread. If anyone, whether it's a student, staff, a teacher, test positive, they will self-isolate at home like we do with any case, away from school and childcare until their case is considered resolved. And anyone identified by public health as a close contact will be tested and quarantined then as appropriate. Will we have to send classes of students home to self-isolate? Quite likely. We may even have to close schools in certain regions. That's certainly possible. But I think I need people to understand that there is no template or a one-size-fits-all approach. There's no cookie-cutter model that we follow, despite what people are asking for. What's the plan? The response to COVID-19 and all other communicable diseases doesn't follow a template. The situation and the nuances of every situation and the context dictates our response. So in any particular case, the risk of exposure to others may differ, and therefore the public health actions may differ. And that's again why we do not have a detailed response plan pre-developed. We certainly have public health principles and frameworks and experience that we follow, but the exact response to an individual situation, whether it's COVID-19 or any other communicable disease, depends on the specific circumstances and the context of that individual case. One of the key priorities, though, I want people to really understand is that communication to parents and families is and will remain a priority in our response to any potential communicable disease cases, whether they're COVID-19 or something else, in our schools. And I have to reiterate, as we're talking about schools, that the best way to protect our schools is to keep community transmission low. We need everyone to continue to follow public health directives on physical distancing, gathering numbers, masking, and practicing good hygiene with frequent hand washing and regular cleaning of common surfaces. We have expectations of what's necessary in a school. That's perfectly reasonable for communities to understand that, but communities also need to understand that there's an expectation of what they're going to do to help keep their students in their community, the teachers in their community. What they do on a day-to-day basis is critically important to allowing those schools to operate safely. We all have a responsibility around this, not just the education system. Because we know that we need to keep our students in school learning and socializing as much as we are able to. When we announced the back-to-school plan, we didn't have a final decision on the before and after-school programs. But earlier today, we were communicating with providers of both the before and after-school programs that they will be able to have cohorts or groups of students in their programs of up to 15 without physical distancing. But they can have multiple groups. Each of those groups of up to 15 have to stay separated from each other. So we'll be able to have run by both before and after-school programs, whether they're in the school or in community sites in a safe manner. And like in our schools, they will be following all the other public health measures around wearing masks, increased hand washing, and increased cleaning, etc. We know that the before and after school programs are critically important and provide a vital service to families, and we need to make sure that they operate safely and follow the public health protocols just as we are doing for our schools during the actual learning time for schools. I know that there's likely going to be questions about why the groups or cohort numbers in these programs are different from the numbers in schools and classrooms, the number in childcare settings, and the number in sports and recreation settings. It's understandable because children may be in multiple different types of these settings throughout the day, each of which may have their slightly different numbers. But you have to appreciate that how the children interact and with each other and the context and the environment in each of these different type of settings leads to us having a slightly different number. We've worked with the people who understand those environments, have expertise, whether it's in sports, whether it's in the after-school programs, both within government, other government departments, or in people who work directly on the front lines, to develop appropriate measures for each of those different contexts and specific settings. And in all of them, the guidelines are designed to limit the number of what we call random interactions between children, especially children who were in different cohorts or groups. I want to move on now to talk about some increased relaxation of long-term care restrictions. Earlier today that we informed the long-term care sector about some additional changes. We were now going to have while indoor visits will continue to be restricted to one visitor at a time, we've lifted the limit on the number of people that a resident can identify for those indoor visits. So now a resident can have, there's no limit to the number of people that they can have on the list to be a visitor. It's just for those indoor visits, it can only be one person at a time. We've also will now be allowing residents to leave their facility with a family member to attend non-urgent medical appointments as well. So those are further steps in returning the ability of residents to have visitation with their family, as well as to have some interactions as were necessary out in the community and visits out in the community. I want to finish off by talking about gathering limits. Well, I said I'm finishing off. Got a few more pages here, so bear with me. Got a lot to say today. On to gathering limits. Currently, the indoor gathering limit for social events, sports, festivals, and special events that are run by recognized businesses or organizations is 50% of the venue's capacity, up to a maximum of 200 people. The outdoor maximum is 250 people. Again, events run by recognized businesses or organizations. For sports and physical activity and cultural events that are not run by a recognized organization, the gathering limit with social distancing is 50 people, both indoors and outdoors. We now have reached some agreement with a few facilities that will allow us to further reopen Nova Scotia. We are taking a cautious approach regarding the hosting of events that support both economic activity, but also is guided with the appropriate level of public health protection given our current epidemiology. So we have been working with 4 venues to provide an opportunity for them to host larger total groups than our total current gathering limits. Those 4 facilities are Centre 200 in Sydney, Scotiabank Centre here in Halifax, the Riverside International Speedway in Antigonish County, and Scotia Speedway near the Halifax Airport. These 4 are able to expand their gatherings because they're hosting large events is at their core business. They are able to manage the stringent public health criteria, and they have the physical infrastructure in their facility to accommodate safely these larger gathering sizes. So the changes for these 4 facilities mean that they can host multiple groups of 200 people for indoor events and multiple groups of 250 for outdoor events, but only if each specific group of 200 or 250 remains separated from the other group. So what we're doing is creating individual bubbles of groups of up to 200 for indoors, 250 for outdoors. And each of those groups must remain separate from each other. And as I've been working with these facilities, as I've said, they have to be separated from lineup to entry to concession to washrooms to exit. And that's why there's only a small number of facilities that have this ability, that they have the space and the number of entrances, etc., that they can accommodate multiple groups, each group being a separate bubble, not being able to interact with anybody from any of the other groups. These 4 hosting venues must submit a detailed plan for review and approval. And that detailed plan has to spell out how all the public health directives and guidelines are going to be effectively met. And we're in the process of reviewing those plans right now with Centre 200 and the Scotiabank Centre in Halifax as they work to be able to host Quebec major hockey, junior hockey games. As I've said, the plan must ensure that the individual groups are kept separate with signage, traffic flow. They're going to be delivering food rather than people going to the concession stand, all those kind of things to make, and that's what we're looking for in the detailed plans before we can give them the approval. So we recognize the need for these larger facilities, but we also recognize that we need to be able to manage larger crowds in a way that we don't end up in a situation where we have hundreds of people who may have been exposed if we do have a case of COVID-19 as part of the audience. That's the rationale of keeping the 200 groups of 200, 250 apart from each other. It's a manageable number that we can deal with if we have to do a follow-up of a case. And while their events are being hosted, there will be inspections at these facilities to ensure that their plans are being followed. And I want to emphasize that this really only applies to these other 4 facilities, and also dependent on the epidemiology. If our epidemiology changes, and all these facilities are well aware of this, we certainly may be backing away from this and creating the necessary level of safety based on the epidemiology at the time. So in closing, COVID-19 will be with us for some time. That is the reality, that we're living with this for another 1 to 3 years. We have to be thinking about that time frame. And while we won't be able to entirely prevent all new cases of COVID-19, if we follow the practices that we know worked in the first wave and have worked in the past to protect the schools and universities from other outbreaks of communicable diseases, I'm comfortable and confident that we can keep our cases low. As a province, we have done we have done very well so far. Our cases have remained low because of our collective effort, all of us working together to keep Nova Scotia safe. But we cannot lose our resolve. We cannot become complacent like we're seeing in other jurisdictions. So my plea to Nova Scotians is to please stay vigilant, care for each other by building safe communities through practicing all the personal preventive measures, and knowing that in the healthcare system and in public health, we have the things in place to do the other components around testing and rapid follow-up. Those 3 key areas working together is what will allow us to continue to be safe. And now I'm done, Premier.
I would have loved him in there when Minister Govine was Minister of Health. You two must have some great conversations back and forth. Chrissy, over to you.
We'll take 1 question and 1 follow-up in the amount of time that we have for today. First question will go to Radio Canada's Cassandra Nadeau-Lamarche.
Hi, Dr. Strang. So it's been almost a month now that the mask has been mandatory. How do you feel about how it's going right now?
We haven't collected any statistics on this, but certainly my own observation and what I'm hearing from a lot of people is that before we made masks mandatory, we were maybe a third of people were wearing masks. Now, virtually everywhere I go, that I see the majority of people, the large majority of people in the indoor environments, in stores, etc., are wearing masks. So I think people were saying, well, how are you going to police this? How are you going to enforce this? And I said at the time, you'll recall, that I believe that the majority of Nova Scotians will do the right thing to keep each other safe, and I believe that they're doing that. And this is all about building really the social norm of masking as we move into the fall, as we move more indoors, and we're likely to see, some further cases of COVID-19. Masking is going to be really important in keeping our case numbers low. But the reality is, masking is also has the potential to have a significant benefit on reducing the impact of things like influenza. Because those viruses are transmitted in exactly the same way. So I'm very encouraged, and I want to thank Nova Scotians for adopting that behavior.
Cassandra, do you have a follow-up?
Yeah, so when restrictions started to ease up, you said that if you had clusters in their region, that you were willing to start up again the restriction, but regionalized. Is it something that you're starting to look for the northern region now that we have a few clusters there, or it's not there yet?
Not that we've had, even though those 3 clusters are all originated in the northern zone. As I said, there's no community spread outside of that 2 cases that occurred with exposure. Their only known exposure would have been in the restaurant at the same time. Even though the clusters are northern zone, there's nothing to say that we have an increased rate of COVID transmission in the community. So we're not at that place yet at all that we need to consider strengthening any requirements or restrictions in northern zone.
Next question will go to News 95.7. Steve, go.
Thank you. Just a quick question on the upping the gathering limits for those 4 places. I'm just curious, as far as in talking to them, the Scotiabank and the Speedway and those places, have you been in communication as far as how this will be economically feasible? Because it seems those sort of numbers are so low, I don't know how they would sort of make a profit out of that. Or, how are you working with them as far as feasibility?
Well, we've given them the parameters under which we felt they can host their gatherings safely. They have to stick with those parameters. It's up to them ultimately to decide whether they can make it economically feasible, but they were certainly looking for some way to have larger numbers than just the 200 or the 250. We recognize that. But that's why we've said you have the ability to accommodate. We're going to stick with the numbers of 200 or 250, but you can essentially have multiple gatherings at the same time as a way to, as I said, to find the balance between some kind of activity, which is an economic as well as a social benefit to the community, but also sticking to numbers and the way people gather that have the necessary level of safety.
Steve, do you have a follow-up?
Sure. It's sort of a more general question. With the announcement of the reinfection in Hong Kong, and I think there was 2 more cases reported in Europe, how does the idea of a reinfection of this virus sort of concern public health, and what sort of changes would this change as far as your protocols?
So what it really means is that there's a lot we don't know yet about immunity from this virus. What kind of immunity you get, how long the immunity lasts for. So it really means that it emphasizes to me, or re-emphasizes the importance that we're going to have to learn to live with COVID for a significant length of time. While we have to figure out whether it reaches some kind of natural plateau or we get some kind of an effective vaccine. But I have to say, even there's a lot of questions about the vaccine. On this type, our experience with flu virus would say that a vaccination against a respiratory virus doesn't necessarily produce lifelong immunity. So maybe that our goals of vaccination is to reduce serious illness, and we may have to have re-vaccination of people. So there's a lot on the natural immunity side as well as on the vaccination side that is yet unknown. So while we're working all that out, we have to stick with our tried and true public health measures. I'm the broken record. My chief medical officers of health colleagues across the country are all the broken record. But it's the physical distancing, the masking, the hand washing, those basic public health tools. That's what we have to work with right now while we try to get answers on these other, the science around this virus.
Next question will go to Mike Gorman with CBC.
With respect to the before and after school program parameters that you've talked about, Dr. Strang, when you've talked about the way you're going to handle elementary schools, the whole concept was to keep kids as close together and isolated from one another as possible. But my understanding of the way these programs work is it's not just kids from one class that go into a before and after program. So I'm wondering how this approach is going to try to mitigate the fact that kids from 8:30 to 3 are going to be very tightly corralled, but then there's going to be intermingling before and after that each day. And Premier, do you have any sense of how these parameters affect the availability of spaces that would ordinarily be there? Like, does this change the availability at all in terms of lessening the number, or is it the same as what would traditionally be there?
Yeah, so we've been working with the after-school programs, recognizing that bringing kids from different classrooms and even different schools, but they're going to try to build their cohorts to minimize that. So let's take example in Halifax, you have the XL program, the after-school program in a school. They'll try to build their cohorts of 15 with, if you have 15 kids from a class, or maybe from the 3 grade 1 classes, so they'll try to minimize the intermingling of people as they build their cohorts, and keeping those cohorts consistent from day to day to day.
I am wondering about whether or not this changes the availability of before and after spaces. But the other thing I'm wondering, Premier, earlier today, Premier Higgs said that there's going to be no change to the Atlantic bubble until at least after the start of grade school and the return of university students. I'm just wondering if you can confirm that, and whether there are any other aspects to the Atlantic bubble rules we need to know about.
So I haven't spoken to the Atlantic premiers directly in quite some time now, but from our perspective, as we're focused on opening our public schools and bringing in our university students now, 800 kids have arrived to go to university that are in isolation. We've done a number of tests that are ongoing for the first round, so we'll be doing that, and we won't be looking at opening up until that process has happened. But that doesn't mean we'll all be going together. I think it's important that if at some point we may decide that we're going to do this alone at some point into the future, but it won't be until after we get through this process of opening up our school system and following through on the isolation and testing of our university kids that are coming in.
Next question will go to Graham Benjamin with Global.
Thanks. Just a question for Dr. Strang on mandatory testing for university students. There's been some concerns raised about students having to actually leave their place of isolation and go get these tests. So I'm just wondering, what's being done to kind of track students as they leave campus or leave their apartments to go get their tests. As well as, I'm wondering, this announcement was made last Thursday, so will this apply to every single student that arrived to Nova Scotia before that announcement came, or is this strictly after Thursday?
So first of all, we recognize that we have to get students to a testing location, so we're working with them to make sure that they go directly from their quarantine to a testing location and back again without interaction with others. They're well aware of that requirement. Your second question is that most of the students are just coming or yet to come, and they'll have the full 2-week isolation. There were some students that came before we announced this that were still within that, had been here for less than 2 weeks, and that they're required to go into finish that quarantine period. And that's why I said a small number of students may not get the full 3 tests, because once we started, they may have been at day 7, and so they really only need 1 or 2 tests. But certainly if they were here and had been here less than 14 days when this program was announced, there was an expectation that they then go into quarantine and remain there till they've been in Nova Scotia for 14 days.
We've added 8 testing sites on university campuses, so we will find that those students who may have to leave their dorm to go to be tested, and then working with the universities, dealing with those that are actually off campus, will go back to the site, one of those sites, to be tested and then back.
Graham, do you have a follow-up?
Yeah, I just had a question on education for the Premier. NSCU is calling for a full health and safety audit of all Nova Scotia schools, and that to be provided to parents by September 8th. Is that in the works right now? Is there going to be that full audit?
So we're doing as we continue to do. There's standards that our public buildings have to meet when it comes to air quality and other aspects. That's been ongoing pre-COVID. It's unrelated to COVID. We're obviously ramping that up. As I said earlier in my remarks, the support from the federal government that has come in will be directed towards making sure that we're supporting students, keeping them safe, increased cleaning, particularly in those high traffic areas where where you would see kids coming in and out of the school buildings as well, but making sure that the ventilation air quality is meeting that standard that is set long before COVID, changing filters associated with all of those. That work is ongoing and will be completed by the time we head back to school.
Next question will go to CTV's Natasha Pace.
Just following up on Graham's question, Premier, the NSTU is looking for specific information to be released, so like how many students are in a class, square footage of the classroom, how much physical distance is between the desks of students. Would that type of information be released to parents before school starts?
No, I mean, we know the class sizes are capped. We capped those long before COVID. Coming into, as you know, we've been working for 7 years to reduce class sizes in the province. This was pre-COVID. Classroom sizes haven't changed since last September. So the configuration will be what our physical footprint is, and then the number of kids that would be in a particular class. I think in primary it's 20, and then depending on where it is as you go through. Obviously, there are some, in all of our classes, we're certainly not going to be able to keep everyone 6 feet apart. So that's the reason for the masking as we go forward. So but that work has been ongoing with the Department of Education, and NSTU has been at the table as we've been developing this program to open our schools back up.
Natasha, do you have a follow-up?
Yes, I'm just wondering, in terms of the 4 venues you're considering opening up to larger audiences, what about the casino? What's the status of that, and why haven't they reopened?
So that's a difference. So there are a number of businesses, casinos one, malls, others, where under the public health order that they can operate their business as long as they can keep people physically distanced. So they don't, but they have ongoing business requirements or business. They have people. They're not just one-time time-limited events. So they're covered under a separate, part of the order. So they're required to keep the casinos required to keep everybody physical distance, and if they can't, then the maximum number they can have in a space is 10. For the gatherings, we've had, as I said, those limit that I outlined, the 200 and 250. But for these 4 events to accommodate larger kind of gatherings, we've as I said to a previous question, accommodated within what I feel is an appropriate level of safety, larger numbers. So essentially, it's multiple gatherings all at one time for a time-limited event, like a hockey game, like a race car event. And if there's other events, say the Scotiabank wants to host in a different kind of event, they would have to come with a detailed plan about how they would continue, how they would run that specific event, whatever it may be, but still adhering to that principle of maximum number of 200 people in an indoor event that could be in close proximity with each other.
Next question will go to Kyle Shaw with the Coast.
Thanks, Chrissy. I'm wondering about the COVID alert tracking app. Health Canada is advising that people download it even in provinces like ours that aren't integrated with the app. Health Canada's theory is that people will be ready for it and waiting. Do you suggest Nova Scotians download the app, and when do you think we will be integrated with it?
It's there available for Nova Scotians to download. We're still in the process. My colleagues in the Department of Health and Wellness are still part of the national discussions around this. It's been piloted in a couple of provinces. We're very interested to learn the impact of this, both the positive and the potential to have a lot of information that comes to local public health for follow-up with potentially not a lot of benefit. So there's a lot of things we need to learn, and we're very interested to see what happens with these initial pilots. But we're directly involved in those conversations, like other provinces and territories, to make a final decision as we get more information about how beneficial this may be and what value add it might play in our overall response.
Kyle, go ahead with your follow-up.
Yes, please. It's about testing students from out of province. I remember when the Panorama system got integrated, and there was one case of someone who's a Nova Scotian who lived in another province, and they tested positive in the other province, but because the Panorama systems were all integrated across the country, we got that case. Remember that?
I don't remember the details of a specific case. Yeah.
Well, okay. So the question is, when you described that case, you said that's the way it's done. A Nova Scotian in another province who tests positive counts in Nova Scotia's case totals. So I'm wondering about students coming from out of province, they're being tested these 3 times, they can be tested through the fall. If they test positive, a student from out of province tests positive, do they go on our case totals and Nova Scotians hear about that? Or does their positive test go on to another province?
They'll be added. They're tested positive here. They get entered through the lab, automatically entered into Panorama. Nova Scotia Public Health does all the follow-up, so they will be counted as Nova Scotia cases. However, having said that, we do have a couple of cases where students have tested positive, but as we've explored that, they were actually positive as a case weeks or months ago in their home province. And what we're determining that they're actually what we're detecting now as we test them in Nova Scotia is residual virus. They're not infectious. So I just raised that there are some circumstances as we do the case follow-up, we would say, well, that's not actually a new case here for Nova Scotia, and that is not being added. But in general, if somebody tests positive now, the students, they're a Nova Scotia case, they're part of our number, Nova Scotia follows them up.
And if we will definitely communicate to Nova Scotians if there's a positive test of a university student coming in. And obviously, the reason we're doing that testing is because if there is one, we'll end up moving in very quickly to make sure that we do not have spread on our campuses across the or out in that community. And the reason, I mean, one of the reasons we have tried for the last 4.5 months, 5 months, is to be upfront and direct with Nova Scotians about what we know and when we know it around this, because it requires all of us to be vigilant, to continue to make sure that we prevent community spread. And we want those communities that are hosting our universities to understand that we're all in this together, and in any information that we receive, we'll communicate it to them, because we'll need their help to make sure that we don't get that community spread. And I'm thankful, really. I can't tell you how thankful I am for the support Nova Scotians have demonstrated when it comes to ensuring that we prevent and continue to work at preventing community spread. And as Dr. Strang said a few minutes ago around mask wearing, once that became mandatory, it's amazing to me, and I live in a rural part of the province where prior to that, very few people were wearing them. Now you see everyone wearing them. So we'll definitely communicate what we know when we know it out to communities.
Next question will go to All Nova Scotia's Lindsay Armstrong.
Hi there, thank you. For Dr. Strang, you've mentioned the 3 clusters of COVID cases and the case of community spread that happened in the restaurant. Can you explain how an individual believed they were not required to isolate? And was this individual contacted by phone or through the digital check-in program after arriving in the province?
No, this individual, my understanding, was not contacted, but became symptomatic and came to our attention very quickly, and we learned that they thought they were in a job category that didn't require them to isolate, which is in fact correct, but that only applies if they're actually traveling because of their work. He was traveling for a different for personal reasons, and was meant to be isolating.
Lindsay, do you have a follow-up?
Yes, thank you. This question's for the Premier. In regards to you stepping down from your post, what are your thoughts on the timeline of finding a new leader? Do you expect to stick around for 6 months until the February convention? And do you plan to stay on as an MLA to keep the party's majority after February?
Well, 6 months is a long time in politics, I will say that. But that is a decision that the party makes. I will be here continuing to work with Dr. Strang as we prepare for what potentially could be a second wave to provide the support to him and to Nova Scotians. We have been in this process from the beginning, and I plan on being here to work our way through this winter.
Next question will go to Nabal Snan with the Herald.
Thank you. Good afternoon. So regarding the testing for university students, I'm just wondering what the rationale is behind the number of tests that the students are required to take. Why is it 3?
Well, the 3 is based on early on, and when they first get here. We have a 14-day period you have to isolate, and that's based on the 14-day income period for COVID. And so we're testing them at beginning, middle, and end. And the beginning and middle are really, we're trying to detect anybody that may be an asymptomatic, maybe asymptomatically infected, maybe when they first came here, or they may have been exposed just before they left, and then they're going to become an asymptomatic spreader, during the middle period. And then the end is also to pick up those people who may be late in the incubation period, but also it's an additional level of, assurance that as they're getting to the end and we're going to release them from their quarantine, that we know that they're negative. So we worked with this with our infectious disease experts and in the Nova Scotia Health Authority to come up with this testing regime. Again, it's based on periodic testing, trying to identify anybody who's asymptomatic, and then having a strict isolation, then keeping them clearly away from anybody else. All students know, and they're all being informed, that if they develop COVID symptoms, then they're contacting 811 and getting tested just like anybody else in Nova Scotia, because then they're shifting from the asymptomatic people quarantining, that testing program, into the symptomatic testing program. But they may well be tested at the same location on the university, but then we're testing them for a different reason.
Nabel, do you have a follow-up?
Yeah. So why did public health decide it was best for the students to leave isolation to get tested? Were other options, like officials coming to the students to collect samples, considered?
When we looked at the logistics of it, it's just simply not feasible to do that in terms of the number of people and the number of people we have available. But that, as the Premier said, we established 8 additional sites, so we have testing sites right on campuses, and people are going to be supported as they come from their residence or come from their off-campus housing to be tested. They can do that very quickly and efficiently, and not have to be expose themselves to other people if they potentially are infectious. So we're comfortable that having that process of the additional number of testing sites we had and the information that students have given, that they can come and get tested and still do that in a safe manner.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. Can you give a little bit more information about the 2 people who were caught the disease at the restaurant? Is it the case that they were with the other person, like sitting at the same table? Was it the next table over? Was it a server? People kind of want to know what the risk factors are, so if you could give us some insight into that.
Well, as I said, what I've disclosed is what we can disclose. They were in the restaurant at the same time as the individual, as our case. I can say we've also tested other people. This was where we did a public alert saying if you were at this restaurant during this time period, you may have been exposed. Come tested. We have tested other people. Everybody else has been negative.
Tim, do you have a follow-up?
Yeah, on that, I'm not sure what the protection of privacy here is. I think I'm hearing from people out in the world, they want to know how people catch the disease. They don't need to know the names of the people or anything like that. They just want to know, okay, so someone caught it at a restaurant. Is it because they were sitting across the table from this person, or was it someone else entirely? Those are 2 different scenarios in people's heads, and they're worried about it.
So, but if I get into details around X person was working there or they were attending with person, then people start to speculate, and we've seen it already with COVID. People very quickly do the thinking and then put things together, and before we know it, we've identified an individual. So we stick with the level of information we give for a very valid reason, Tim. That there's a legal obligation for us to not disclose people's individual health information.
Next question will go to Ed Halverson with QCCR Radio.
Yes, thank you. Dr. Strang, I have a question about last week. The Department of Education said that only international students who remained in Nova Scotia through the summer can attend public schools this fall. That would be the high schools, junior highs. What concerns did you have, and what direction did public health provide to the Department of Education?
So I've had a number of discussions with about international students. Certainly people have remained here, and we also have a number of university students, especially up at Cape Breton, international students who have remained here throughout the first wave and through the summer. Their risk is the risk of anybody else in Nova Scotia. The risk about people coming from internationally is we're in a global pandemic. and it's always increases the risk, and we bring people from other parts of the world into Nova Scotia. And I gave my perspective, that perspective to the education, my colleagues in education, that having students come live with families here in Nova Scotia does put us at increased risk of bringing COVID-19 into the province. So there's a good reason why we're being cautious and not allowing individuals to come in to finish whatever junior high or high school from other parts of the world. It's unfortunate, but it's part of the reality of making some choices that we have to do to have an appropriate level of caution and safety around COVID.
Ed, do you have a follow-up?
Yes, I do. Dr. Strang, again, the Nova Scotia International Students Program did submit a plan that included 14-day supervised quarantine in hotels, similar to the plan that's enacted for university students. Why is the difference treatment, the approach between the two groups?
So, I mean, I think you really should ask the education. I mean, I think it's about the level of risk, and these students live out in communities with families, a number of factors, and they felt with all the other things going on that was another added risk that was not necessary to take. But I gave a perspective. I wasn't involved in the final decision making.
And I think it's important to recognize that our university students are come by and large either in dorms or they share housing together. Easier to be able to do the testing, ensure the 14-day isolation. As Dr. Strang said earlier, many of our international students they're hosted in families. That's how that program works. They're not a dormant. They don't come and stay in dorms. They stay with individual Nova Scotia families. The risk if someone was positive to be spread in the community was higher. It was felt it would be higher. And at the same time, we are then entering them into our public education system. As you know, some of our universities are actually doing online programming, et cetera, finding different ways to be able to deliver that program in our public education system. It'll be in-class learning, and it was just felt at this time it made more sense to review that. I want to tell you those international students are an important part of our children's experience when they're in school. I know when my kids were in school, there were many international students who'd come to the high school they were in, gave them a broader perspective of the world and community. It is certainly and definitely the desire of our government to restart that program at the appropriate time, but it just made sense and that we would err on the side of caution when it came to that and open up our schools with our kids that are here. And then we would review that program in a second semester.
Next question will go to Bill Martin with 6 Rivers News.
Question for Dr. Strang regarding the recent evidence that some people who've been infected earlier in the epidemic are being reinfected. And more recent than that, the suggestion is that some tests indicated it's now a slightly different strain. Would this be common, as in influenza, and having to have a different vaccination each and every year for the different strains?
So I don't know the answer to that. Nobody knows. I mean, and how common this reinfection is. This is the first documented case with sufficient laboratory proof to say it was 2 different strains of the virus. As I said to a question earlier on today, there's a lot we don't know yet about this virus. How immunity works. Is this going to be the coronavirus that shifts and changes like influenza? Other coronaviruses, and there are many of them that we have lots of experiences with, and they cause the common cold and things like that, don't do the same kind of shifting that influenza does, but only time will tell. There's a lot of science needs to happen to allow us to continue to understand this virus more, but I do want to repeat the point that I came back to made earlier, that what we do know is all the public health measures, both personally and collectively, that work to actually prevent the spread of this virus. That's what we need to be focusing on collectively while we let the scientists do the science.
Bill, do you have a follow-up?
Yes, thank you. There's also new anecdotal evidence coming from other jurisdictions that the rise in infections of late have come to younger generation, people perhaps 40 and younger. And that, of course, is quite different from what we experienced in Atlantic Canada, where it seemed to disproportionately affect seniors. Is this a result of perhaps the unwillingness of the younger generation to adhere to guidelines, or is this, again, something different in a new strain?
So I think I'm not aware at all that it's associated with a new strain. I think we got to be careful also with targeting a whole or labeling a whole demographic with the same brush. There certainly have been a lot of stories, and I've talked to my colleagues across the country of groups of younger people who are ignoring completely the rules around socializing. But we also know there's lots of people in all ages who are sticking to the rules. The risk is though that all it takes is a small group of people not complying, and that's the lesson we have to take. We also have to understand that the increasing numbers in younger age demographics are also that there are many of the age groups that are working in environments like in grocery stores, like in coffee shops, and in social environments as well. So they may also be more at increased risk of being exposure given their occupation. So it's complex, but I just want to warn against just taking a broad brush approach and targeting, labeling with a negative label a whole generation, if you will.
And that's all the time that we have for today.
Thank you, Chrissy. We are 2 weeks away from school reopening, and this will be a school year like none other. Kids will be wearing masks, keeping their distance from each other, and socializing differently. It will be hard, and we know that. We have a strong back-to-school program. It has been studied by experts and ranked as one of the 3 best in the country. And that's because so many people have been working to put it together. That wasn't done behind closed doors. We consulted with public health. We consulted with doctors and pediatricians at the IWK. We included feedback from the Nova Scotia Teachers Union. And we applied what we heard from over 28,000 parents and teachers who filled out the online survey. As the first day of school draws near, we will also apply the lessons that we've learned from the first wave of COVID-19. We have more experience, public health has more information, and we are ready. I want parents to send their children back to school with confidence that we are doing everything we can to protect them. And quite frankly, as Dr. Strang said earlier, it's okay to be nervous, because we all are. But our children need to be back in a classroom, back with their friends, and back to what is close to normal as can be under these circumstances. I want to reassure parents that if there's a spike, our plan is flexible, and we have a number of options available to us. The most important thing is, though, that we work together. Teachers, staff, parents, students, and the education department. We are all in this together, and we can do this.
Okay.